Hey everyone, welcome back to the deep dive. Today we're going to help you understand some medical information you shared with us.
Awesome.
We're doing a deep dive into the world of chronic pancreatitis.
All right.
Yeah, so I know that sounds a little intimidating,
Yeah.
but we're going to break it all down together, and you'll be surprised by some of the fascinating things we've learned about, how this condition is diagnosed, what causes it, and what the long-term effects might be.
Yeah, it's all about,
Yeah,
understanding the clues,
right.
putting the pieces together.
It's like we're medical detectives.
Exactly.
Okay, so let's start with the diagnosis.
Uh,
We've got this excerpt from abdominal14.pdf,
hmm.
which kind of paints a little bit of a picture for us, right? It mentions epigastric tenderness,
Right.
so pain in the upper abdomen, I'm guessing,
That's right.
and the patient was using fentanyl patches?
Yeah.
That seems like a pretty strong pain reliever, wouldn't you say?
You're right to pick up on those details. Chronic pain is a major characteristic of pancreatitis, and fentanyl patches are typically used to manage severe ongoing pain.
Wow.
The document also mentions a tracheostomy and a central line scar, suggesting a recent serious medical event potentially linked to the pancreatitis.
So it sounds like this person has been through a lot.
Yeah.
Okay, so we're trying to piece together, what happened here.
Right.
And the document also points out what's not there.
Yeah.
No signs of liver disease or swollen parotid glands,
Right.
which makes alcohol abuse less likely.
Less likely. Yeah.
Plus, no cholecystectomy scar.
Uh-huh.
So gallstones are probably off the table too.
That's a great observation. Ruling out common causes is just as important as identifying the potential culprits.
Right.
So if alcohol and gallstones aren't the main suspects here,
Yeah.
what else could be causing pancreatitis?
Well, the document mentions trauma, high levels of triglycerides or calcium in the blood, and even some medications like steroids.
Mm-hmm.
You mentioned earlier that a procedure called ERCP could also be a factor, but we'll get into that a bit later.
Yeah.
What really caught my eye was the mention of genetic causes.
Okay.
The document says pancreatitis can run in families, and I think that's particularly relevant to our listener today.
You're absolutely right to focus on that. Genes can definitely play a role in developing chronic pancreatitis.
Wow.
If you think about it, it's pretty amazing how our genes can have such a significant impact on our health.
Yeah.
The document specifically mentions cystic fibrosis, PRSS1, and SPNK1 genes as potential hereditary causes.
Oh, wow.
Makes you think about your own family history, doesn't it?
It really does. It's amazing how much information is packed into our DNA.
It is.
But let's shift gears a bit and talk about the long-term view. What complications can arise from chronic pancreatitis?
Chronic pancreatitis unfortunately can affect multiple systems in the body. In the acute phase, it can lead to a systemic inflammatory response syndrome, or SIRS,
Okay.
similar to sepsis, which is a very serious condition. It can also cause respiratory failure and, in severe cases, even death. As the condition becomes chronic, it can lead to blood clots in the portal vein and the splenic vein. And there's another concerning complication called pseudocysts.
Okay, pseudocysts. That sounds a bit scary. Can you break down what those are and how they affect the body?
Essentially, they are fluid-filled sacs that can form within or around the pancreas.
Okay.
Imagine your pancreas is like a plumbing system, and these pseudocysts are like blockages causing pressure to build up.
Oh.
The document talks about their compressive effects, meaning they can press on nearby organs like the duodenum, the biliary system, or even the pancreas itself, causing all sorts of problems.
Wow.
And to make matters worse, they can also become infected.
Wow, that's a lot to process.
Yeah.
So how are these pseudocysts treated? The document mentioned something about drainage.
Yes, exactly.
Yeah.
Endoscopic drainage is the preferred method. They use ultrasound guidance to drain the fluid from the pseudocyst into the gastrointestinal tract.
Wait, so they go in with a tiny camera and drain the fluid? That's incredible. And the document mentioned something called an AXIOS stent. What is that exactly?
It's a spiralized stent designed specifically for draining pseudocysts. Think of it as a tiny scaffold that helps keep the drainage pathway open.
So it's like high-tech plumbing for your pancreas. I have to say I'm fascinated by these medical advancements. But with all this talk about complications, I can't help but wonder, what's it actually like to live with chronic pancreatitis on a day-to-day basis?
Managing chronic pancreatitis often involves making some major lifestyle changes and focusing on effective pain management. One of the most important things is avoiding triggers like smoking and alcohol.
Okay, that makes sense. Those habits are already known to be harmful, but I imagine they would be especially bad for someone with pancreatitis.
Absolutely. Those habits can irritate the pancreas and make the condition much worse.
Yeah.
Managing pain is another crucial part of living with chronic pancreatitis. The document mentions creon, which is a pancreatic enzyme replacement therapy, often used alongside a PPI, a medication that reduces stomach acid.
So if I'm understanding this correctly, Creon essentially helps your body digest food properly when your pancreas isn't functioning at 100%.
That's a great way to put it.
But is it only for severe cases of pancreatitis, or are there other situations where it might be needed?
That's a great question. While Creon is definitely used to address malabsorption, which can be a very serious complication, there are a number of clinical indicators that might suggest it's necessary.
Okay,
We'll
then.
dive into those details in just a bit.
Okay, so we've talked about some of the potential causes of pancreatitis,
Right.
from alcohol and gallstones to genetics and even certain medications.
Mhm.
But I'm looking at this document and it seems like there are a whole bunch of other culprits we haven't even touched on yet.
You're absolutely right. We focused on the usual suspects,
Yeah.
but there's a whole world of less common but equally important causes to consider. For instance, the document mentions hypercalcemia,
Okay.
that's high calcium levels in the blood, and hypertriglyceridemia, which is high levels of triglycerides, a type of fat. Both of these can actually trigger pancreatic inflammation.
Interesting. So even things that might seem unrelated to the pancreas can actually play a role.
Yeah.
What else is on that list?
Well, there are certain medications like azathioprine that have been known to cause pancreatitis,
Okay.
although it's usually the acute form rather than chronic.
Right.
And of course, we can't forget about smoking,
Right.
which, as we've already mentioned, is a major trigger to avoid at all costs.
Smoking seems to be on the naughty list for so many health problems.
Yeah, it is.
It's no surprise it's a factor here too.
Exactly. And then we have some more specialized causes like ERCP, which we talked about earlier.
Right.
It's a procedure used to diagnose and treat certain pancreatic and bile duct problems.
Right.
But ironically, in some cases, it can also cause pancreatitis.
Oh, wow. So it's a bit of a double-edged sword.
Hmm.
It can be both a treatment and a potential cause.
Precisely. And the list goes on. There are conditions like IgG4 disease, sometimes referred to as autoimmune pancreatitis, where the body's own immune system attacks the pancreas. Then there's pancreatic divisum, a congenital anomaly of the pancreatic duct, meaning people are born with it. And even pancreatic cancer itself can sometimes present with symptoms similar to pancreatitis.
So there's a whole range of potential culprits, and some of them are pretty unexpected.
Yeah,
It really highlights how important it is to get a proper diagnosis from a medical professional, right?
absolutely.
I mean, this isn't something you want to try to figure out on your own.
You hit the nail on the head. Self-diagnosis can be dangerous, especially with a complex condition like this.
Yeah.
Speaking of diagnosis, the document also goes into more detail about the genetic factors we briefly discussed earlier.
Right. I remember you mentioning cystic fibrosis, PRSS1, and SPMK1.
Right.
Are those the main genes to watch out for if someone has a family history of pancreatitis?
Those are definitely some of the key players, particularly for younger patients or those who don't have a history of alcohol abuse.
Okay.
Genetic testing can provide valuable insights and help guide treatment decisions.
So if I'm concerned about my family history, that's something I should bring up with my doctor.
Absolutely.
Yeah.
Now, regardless of the cause, the document paints a vivid picture of how chronic pancreatitis can actually manifest.
Okay.
And it's not just a simple stomach ache, is it?
It sounds like it can affect the body in a lot of different ways. What are some of the common symptoms people experience?
Well, the classic presentation is chronic epigastric pain, meaning pain in the upper abdomen that often radiates to the back.
Okay.
It's frequently relieved by sitting up and leaning forward.
I can only imagine how uncomfortable that must be.
It can be debilitating for some people. The pain can be constant or come in episodes, and sometimes it's triggered by eating.
Wow.
And then there are the symptoms of pancreatic insufficiency,
Okay.
which happen when the pancreas isn't producing enough enzymes to break down food properly.
Right, we talked about Creon as a treatment for that. But how would someone know if they have pancreatic insufficiency in the first place? What kind of testing is involved?
Doctors look at a combination of factors, including symptoms, medical history, and lab tests. They'll ask about things like diarrhea and weight loss, calculate your BMI, and run blood tests to check for things like anemia, low albumin levels, magnesium deficiency, and vitamin D deficiency.
Wow, so it's pretty comprehensive.
It is. And a key test is measuring fecal elastase.
Fecal elastase. Okay, now you've got me curious. What exactly is that?
It's an enzyme produced by the pancreas that helps break down proteins. If your pancreas isn't functioning properly, you won't have enough elastase in your stool.
So it's like checking your car's exhaust to see if the engine is running right.
That's a great analogy. However, even a normal fecal elastase test doesn't completely rule out pancreatic insufficiency. There's also a breast test that can be done, but is not widely available yet.
So even if the tests come back normal, there's still a chance something could be going on.
Exactly. That's why it's important to consider the overall context. Someone with calcifications in their pancreas or a pancreatic duct obstruction might have some degree of insufficiency, even if they aren't experiencing obvious symptoms.
So if I have those calcifications, does that automatically mean I need Creon?
Not necessarily. Your doctor will consider all the factors and recommend the best course of treatment for your individual situation. But speaking of Creon, if pancreatic insufficiency is diagnosed, it's often a key player in the treatment plan.
Right, those pancreatic enzyme supplements. Can you remind me about the typical dosage and how they're taken?
Sure, your doctor will determine the right dosage for you, but it typically falls between 75,000 to 125,000 units with meals
Okay.
and 50,000 to 75,000 units with snacks.
Got it.
And it's crucial to take it with a PPI to protect the enzymes from being broken down by stomach acid.
Protect those precious enzymes. But what about diet?
Right.
I would have thought a low-fat diet would be recommended for someone with pancreatic insufficiency.
That's a common misconception. But no, the advice is to stick to a healthy, balanced diet, not necessarily low fat.
Really? That's surprising. I would have thought limiting fat would be essential.
It's more about overall nutritional balance than restricting fat intake. Now, we've touched on some of the complications associated with chronic pancreatitis,
Right.
like type 3 diabetes and the increased risk of pancreatic cancer.
Right.
Are there any other complications that we should be aware of?
The document mentions pancreatic ductal stricturing, which sounds incredibly painful.
It can be. It's basically a narrowing of the pancreatic duct, which can block the flow of digestive enzymes.
Okay.
This often requires interventions like ERCP stenting or even surgery.
That definitely doesn't sound fun. Are there any other serious complications to be aware of?
Yes, pseudocysts, as we discussed, can cause significant problems if they persist,
Right?
and often require drainage using that specialized XIS stent.
Right, the tiny pancreatic scaffold. It's amazing what they can do with medical technology these days.
It is. Another potential complication is biliary obstruction, which is when the flow of bile from the liver is blocked. This can also be managed with ERCP and stenting, or in some cases even surgical bypass.
Wow, it seems like chronic pancreatitis can really impact a lot of different parts of the body.
It really is a multi-system disorder.
Yeah.
That's why a multidisciplinary approach to care is so important.
So it's not just your gastroenterologist you need to see, but potentially other specialists too.
Exactly. Depending on the specific complications that arise, you might need to consult with endocrinologists for diabetes management,
Okay.
surgeons for interventions, pain specialists for pain control, and so on. It really does take a team effort.
It sounds like having a strong support system and a knowledgeable medical team is absolutely essential.
Yeah.
But with the right care and a proactive approach, it seems like people can live relatively normal lives even with chronic pancreatitis.
Absolutely. And that's a really important message to emphasize. This condition can be challenging, but it doesn't have to rule your life.
We've covered so much ground already, from the causes and symptoms of chronic pancreatitis to the diagnostic tests and treatment options. It's been a real deep dive.
It has, and as we wrap things up, it's important to remember that this is a multi-system disorder, often requiring the expertise of several different specialists.
It's like assembling an all-star team of medical professionals to help you navigate this complex condition.
Right.
And one of the most important things they focus on, I imagine, is pain management.
Absolutely.
Yeah.
The document we've been looking at outlines a range of options, starting with simple over-the-counter painkillers like paracetamol.
Paracetamol, so just basic Tylenol, right?
That's right. It can be surprisingly effective for mild pain. And then there are NSAIDs like ibuprofen or naproxen, which can also help reduce inflammation.
So those are like the first line of defense against the pain monster?
Exactly. But if those aren't enough, there are prescription medications like pregabalin or gabapentin, which are often used for nerve pain.
I've heard of gabapentin. Isn't it used for all sorts of nerve-related issues?
Yes, it is. And then in more severe cases, stronger opioids like morphine or fentanyl might be necessary.
But opioids are serious business, aren't they? I mean, there are a lot of potential risks and side effects to consider.
You're absolutely right to be cautious. Opioids should only be used under the careful supervision of a pain management specialist.
Right.
They can help find the most effective and safest approach for your individual needs. It's about finding that balance between pain relief and minimizing any potential harm.
That makes sense. It's not just about masking the pain, it's about finding a sustainable solution. But pain management is only one part of the picture, right? Lifestyle changes are also crucial.
Absolutely. And the two most important changes are eliminating alcohol and quitting smoking.
So no exceptions to that rule.
None whatsoever. Those habits are incredibly damaging to the pancreas and can make chronic pancreatitis much worse.
Wow.
It's like pouring gasoline on a fire.
That's a powerful image. I definitely wouldn't want to do anything to make things worse. What about other lifestyle factors like diet?
We talked earlier about how a healthy, balanced diet is important,
Right.
and that holds true even if you don't have pancreatic insufficiency.
Right.
But the document also highlights something else that might surprise you: the importance of addressing any vitamin D deficiency.
Vitamin D. I wouldn't have thought that would be a major concern with pancreatitis.
It might seem unrelated, but chronic pancreatitis can impair the pancreas's ability to absorb nutrients, including vitamin D.
Oh.
And because vitamin D is crucial for bone health, calcium absorption, and immune function, a deficiency can lead to other problems down the road.
So it's like a domino effect.
Yeah.
Pancreatitis affects nutrient absorption, which then leads to other health issues if it's not caught and treated.
Exactly. That's why regular monitoring and supplementation are often necessary.
It's all about staying ahead of those potential complications.
Huh.
Well, I feel like we've covered a tremendous amount of information today. Causes, symptoms, diagnostic tests, treatment options, long-term implications. We really went deep.
We did. And I hope you feel more informed and empowered after this deep dive. Knowledge is power, especially when it comes to managing a complex condition like chronic pancreatitis.
I couldn't agree more. The more you understand about your condition, the better equipped you'll be to work with your medical team and advocate for your needs. And remember, you're not alone in this journey. There are resources available, support groups, and a whole network of healthcare professionals ready to help.
That's right. Don't be afraid to ask questions, seek out information, and reach out for support.
And on that note, I want to leave our listener with one final thought. We've talked a lot about managing the pain and complications of chronic pancreatitis, but what about preventing further damage to the pancreas? What does the latest research say about that?
That's a great question to explore with your doctor. Thanks for joining us on this deep dive into chronic pancreatitis. We hope you found it informative and empowering.
Until next time, stay curious.